Actually, we're in San Francisco, so Stanford is close by, one of the most amazing institutions in the world, and leading in innovation technology, of course, and medical care. Myofunctional therapy is actually designed, tongue training exercises is been actually shown to give benefits immediately. There are patients who get a 30% benefit just from doing exercises to be able to help stop their sleep apnea and make sure that they can breathe really well.
Hello, Dr. Patel. You are the founder of Green Dentistry and holistic dentistry practice in San Francisco. So, welcome to Modern Healthspan, and thank you so much for joining us today.
So excited to be here, Richard.
So, Dr. Patel, can you explain what is a holistic or functional dentistry, and how does that practice and how does that differ from like a conventional dentist?
Well, a holistic and functional dentist is very different from a traditional dentist. The main thing is that most dentists are looking at if there's a cavity, let me fill it. If your gums are bleeding, let me clean you. But a holistic biological or a functional dentist is going to look at the root cause of the problem. Did you know that bleedy gums can be signs of heart attack, diabetes, cancer, Alzheimer, or arthritis? Because there's specific bacteria that cause these diseases, and believe it or not, they start in the mouth. So, a holistic, functional, or a biological dentist is testing, number one. Testing, just like a medical doctor would test the blood, a functional, holistic, biological dentist is going to test your saliva and to see what kind of bacteria are inside. How is your body responding to inflammation? And how can we help you live a long, healthy life through your mouth?
What is actually happening in the mouth that creates these systemic effects?
So, one of the things we know all of life is inflammation. We know all of disease is inflammation, and aging is inflammation. So, when we look at the mouth, we really are looking at, we used to think that, the purpose of teeth is just to help chew and that was it. But in reality, the mouth is an ecosystem, just like your gut is. And so we're looking at specific bacteria that are number one, causing heart attack, diabetes, cancer, Alzheimer, arthritis. That's one piece. The second piece that we're actually looking at is your tongue position, because believe it or not, your tongue is part of your functional airway. And we know majority of disease is caused because people are not able to breathe really well. And it's because they don't get that nitric oxide that's naturally created through the nose and through the mouth.
Okay, so let's take those in two parts. Let's start off with the bacteria. So we have a microbiome that lives in the mouth, and how does that impact like systemic inflammation?
So there are specific bacteria that we actually look for. So when we are looking at heart attacks or strokes, we actually now know specific bacteria. There are six of them that actually, once they pass through the enteric lining, they have access to the bloodstream. As they have access to the bloodstream, it as your body incites inflammation, it actually binds to cholesterol and releases tumor necrosis factor alpha, which stiffens the arterial walls, and what that does, it starts clogging the arteries, and that's what we call heart attack or strokes.
Okay, so you're seeing these bacteria in the mouth. So tell me a little bit about the saliva test. When you do the saliva test, what are you looking for? Is it just the bacteria or is it other metabolites as well?
We're specifically looking for two things. The first thing in a salivary testing is we're looking at interleukin 6, which is your inflammatory marker that will let us know how your body is responding to inflammation. Also, it'll let us know if you're at high risk for heart attack, diabetes, cancer, Alzheimer, arthritis, osteoporosis. any chronic inflammatory condition. The second thing we look at is specific 13 species of bacteria that we now know incite disease. They have been correlated and causative for specific diseases.
Okay. So normally we do blood tests, right? Which are, well, not very invasive, but a little bit more invasive than a saliva test. Are you seeing many of the same metabolites in the saliva?
So when we are looking in the saliva, we're seeing that. So what happens is we look at the blood, it's already inflammation has already occurred. We are already seeing the metabolites, like you were saying. When we are looking at dentistry, we're trying to get to the beginning stages, the preconditions of disease, preconditions or pre-environment of what disease is caused by. And that's what we're looking for is we want to look at it in advance. For example, I'm going to share my screen with you so that you can see some sample testing that we've done for specifically the one that we're looking at here are the bad bacteria that are, well, causative for disease. I'm going to share my screen here, and these are actual examples of patients. And so we can see here, these are the previous conditions. We have PG, TF, TD. These guys are a causative for heart attack, diabetes, cancer, Alzheimer, arthritis. We also see FN, which is known to be associated with a lot of cancer patients, PI with acid reflux. So a lot of different things are seen on these. These are 13 species of bacteria. We look at them in just like how I would interpret this is green light, yellow light, and red light. These red light are the worst ones, and they're the causative species of bacteria. So what we're looking at with these bacteria is number one, what is present. Number two, how much of is present. Number three, what is the patterning of the ecology of the mouth? What does the biofilm look like? Because you see these certain bars here. We want the ecology or the biome to be in a specific pattern because when we sometimes find two of the same bacteria at the same levels, they're usually resistant types of bacteria. And so we want to treat them differently. And so when we're looking at the oral microbiome, we're looking at just like a gut analysis would be. We're looking at presence and absence of. What we can test with both ways, either presence of or absence. In this case, we're looking at the presence of these 13 species.
Okay. And then these species are particularly, well, the red ones are uh, not friendly, and they have a negative impact on inflammation. So how do they pass the inflammation into the body?
So what happens is when you're swallowing 5 gallons of bacteria every single day, for example, let's start with I'm going to use myself as an example. I'm a perimenopausal woman in late 40s. My mouth is super dry. I am really routine about going to the dentist because, of course, I am a dentist. Now, there's preconditions of hormonal changes, this dryness that occurs in my mouth. It creates a perfect environment for specific bacteria to overgrow, especially the red ones like we were talking about. Now, if I don't add in adjuncts, things that will help me with substitute saliva, things that will help me keep my mouth hydrated every single day, what happens is these bacteria would overgrow. When they would overgrow, it would take about a year, year and a half or so before they pass through the enteric lining and incite inflammation into the arteries. The reason being is that we are healthy, right? We're swallowing those 5 gallons of bacteria every single day. When we swallow those 5 gallons of bacteria every single day, um, that over time is when the cellular interlinking of the gut is opened up, kind of like in SIBO. We see that the cells that are nicely, the tight junctions that are normally really nice and tight are actually opened up. And that's how the bacteria get access to different parts of the body.
Okay, so the bacteria in the mouth, they're making it through the stomach, which means they can
Yes.
get through the acid anyway, and then they're getting through through the gut into the body. Do we see that any bacteria get through from the mouth, like directly into the bloodstream?
Typically, the only way we could do that is when there's bleeding of the gums. When there's bleeding of the gums, there is an open artery, right? That's what bleeding gums that tell us. That's when the bacteria have direct access to the bloodstream. Typically, in dentistry, bacteremia or something along those lines is not going to happen unless you have a really, really, really bad infection into a tooth. So that is why I love dentistry. It is so nice, so non-invasive, and full of so much information about our bodies.
I thought that one of the mechanisms by which the oral microbiome could impact, say, Alzheimer's, was because of the proximity of the mouth to the brain. But that would imply that that's not the way it works.
Mm-mm. The way that it would work is, especially PG, P. gingivalis, is known to be causative for Alzheimer's. And there's two ways in dentistry how there's a big, massive correlation, actually three massive correlation. One is PEG has to be in your mouth for a very long time and has access to the bloodstream. It's so small. PG is so small, kind of like COVID was, right? COVID was able to get through our defenses because it was so small and our system could not protect itself. PG is very, very, very small and it can actually go through the blood-brain barrier over a period of time because it'll weaken the barrier just like we had with the gut lining. It gets weakened like with SIBO or any other diseases. The same thing with the blood-brain barrier over time opens up and the PG penetrate into the brain. And that's how it's linked to Alzheimer's.
Right. But its route into the body is through the gut.
It's through the gut. Yes, its root is through the gut. The only way it would have access to the brain is if there was a massive infection in the sinus, or if there was a massive dental infection that traveled all the way through, because we do know that our cranial nerves exit. There are some exits throughout the brain, right? So those would be the entrance points for these specific bacteria. But at this point, the ones that we're actually talking about when it comes to Alzheimer's is actually through the stomach. Number one. The second thing that we want to look at with Alzheimer's and dentistry is actually going to be old amalgam fillings, mercury fillings, because those mercury fillings are neurotoxins. So when mercury fillings are in the mouth, they will actually stop the cells from growing, and over time can lead to Alzheimer's and dementia. The third thing that we look at is also foci of infections. We can have access to the bloodstream, which is going through like a failed root canal that has a massive infection that's sitting inside the bone because the bone does have arteries in it. That is where they'll get access into the brain, into the body, into other areas.
Okay,
Fascinating,
there,
right?
yeah, there's so much to unpack in there. I mean, there's the mercury, and then there's the root canals, and whether there's infection sitting underneath them. Um, okay, but for the moment, sticking with the microbiome. So, can you can you have like good looking teeth, and like nothing obviously wrong, and but still have bad microbiome?
Absolutely. You absolutely can. And the most patients I see that with are my sleep apnea patients. People are in their 50s and 60s. Anybody who has a dry mouth is going to have a negative microbiome because, again, that environment is dry. When you have a dry environment, it makes these specific bacteria overgrow. So it is very, very, very common to see patients who have beautiful teeth have these imbalanced microbiome. I also see it on patients who have high blood pressure medications or on anti-anxiety medications because they all contribute to a dry mouth, which creates this perfect storm or perfect um, environment for these bacteria to overgrow.
So you did refer to it taking like a year or so, and then um, for it to, I think, for the microbiome to build up and then to get into the body. So, what kind of time frame is this? Something that happens slowly, or is if you get the wrong bacteria, is it like an immediate concern?
It's so one of the things about the microbiome and bacteria, it's a chronic illness, right? It's a slow moving illness. So from starting with somebody's oral microbiome, let's say they start with a bad oral microbiome, right? The first thing that's going to occur is a bad oral microbiome. About a year and a half or so is it's going to break through the enteric lining because our body's defenses will break down at a certain point. And typically we see disease happen about 10 to 13 years later.
Okay, so it's a very early warning for a risk of downstream chronic diseases.
It absolutely is. And it's also a great way to bio-optimize yourself. So if you wanted to bio-optimize yourself and prevent diseases in the next 10 to 13 years, you would start with the mouth. And that's what makes dentistry very, very, very exciting.
So how many places can people get this kind of oral microbiome? Well, yeah, oral microbiome test because
You know,
I'm not not so familiar with it.
there, there are so many companies that actually do an oral microbiome test. Rupa Health, we can order it through Rupa Health now. We can order home kits. The ones that I specifically do are designed more for practitioners because we're also looking at interleukin 6 and how the body is responding. There's a lot of different companies that actually do salivary testing and it's becoming more and more the norm because it's so much easier to be able to do a nice spit test versus a blood draw.
It is, and hopefully these companies would provide some kind of an analysis. Just because if I just get a list of bugs, it's not going to help me much.
No, they do. They provide analysis and they will provide it guidance as much as they can. However, in many situations, you actually need a professional to be able to treat the disease, right? So it's easy to, if my solution for you, Richard, was, hey, your mouth is really dry. I'd like for you to try this mouthwash because your microbiome is not bad. It's not good, but it's okay. It needs a little bit of work. That is very easy to do. And it's exactly what we would rather do than, hey, say, hey, Richard, there's a lot of bacteria in here. I need to see you in the office so that we have to do certain procedures. We have to monitor it again. We have to test it again, make sure it's removed. And, so that you don't need additional treatments, right? We would rather see disease get diagnosed sooner and be able to make changes in your lifestyle and add adjuncts. Like instead of putting patients on, for example, on medications, it would be really nice to be able to add some supplements, right? That's what we want to do in functional medicine is give the body the nutrients it needs so it can work better. And that's what I want to do as a holistic biological dentist as well.
Okay. Um, so previously you talked about nitric oxide and the microbiome creating the nitric oxide. Do you do you see that mouthwash interferes with the microbes that do that?
Absolutely. Alcohol containing mouthwashes will have a detrimental impact on the microbiome. What is going to do? Alcohol is actually going to dehydrate the mouth, which is exactly the opposite, right, of what we want. We want hydration in the mouth, and it actually kills off bacteria that we want to keep. And nitric oxide is really important because they really help nitrogen reducing bacteria actually is really important for us so that we can create nitric oxide in our duodenum, right? Because we need the acids from the stomach. And then it goes through the duodenum where our body actually absorbs the nitric oxide. That's one spot. And I'm going to add in one more, which is really important that most people forget where nitric oxide is created, which is the nose. And believe it or not, your mouth has a lot to do with your nose. So we do want to touch upon that. People who have had their teeth extracted and their faces jammed shut for years as they were growing have small nasal passages and have smaller amounts of nitric oxide that their body absorbs and makes. So we definitely want to focus on making sure that there's really good nose breathing and really increased amount of nitric oxides.
So we have periodontitis, right? So periodontitis is bugs in that are eating away at the bone and stuff. Um, are these the same ones that cause the systemic problems, or are they different ones and a different way to deal with them?
They actually are the same ones, and that's one of the reasons why we look at P. gingivalis, which is well known to cause gum disease and eat away the bone. These are the same bacteria that are known, and they're inflammatory, chronic inflammatory conditions, right? Gum disease is a chronic inflammatory condition. It takes a lot of these bacteria to be in your mouth for a long period of time for them to eat away the bone. And so it is the exact same bacteria that cause gum disease or bone loss that cause systemic conditions.
Okay, so if we hopefully if we get rid of one, we can get rid of the other. Yes. Now the in periodontitis, the bacteria are quite deep inside. So is can we get rid of them in the same way that we would like any other, like maybe bacteria that are on your teeth?
Absolutely. So the first way we start when we find somebody with bacteria like this, Richard, is that we start with removing them through removing the biofilm, right? Mechanical disruption of bacteria. Because hey, let's be honest, we all have bacteria, right? We have good bacteria, we have bad bacteria. We just want to get rid of the bad ones, let the good ones survive. So we always start with a cleaning. The cleaning is designed to remove, mechanically disrupt the biofilm. That's what we really want to do. Now, if those bacteria, we retest them, if they're still in the body after like a deep cleaning with laser, what that really means is there's so much bacteria in the blood, and that's when we consider systemic antibiotics to make sure that all the bugs are killed off.
So moving on to the tongue. So you talked right at the beginning about the microbiome and the tongue. So how does the tongue impact the way we breathe, especially as we're meant to be breathing through our nose, right?
Right. We are meant to be breathing through our nose. What has happened throughout evolution and also modern intervention through braces is that as people are developing from young childhood to adulthood, when their mouths are jammed shut through braces, as we know, the entire skull is connected by sutures, right? Each bone is connected to another, and there's cranial sutures that actually exist. Development is designed, for example, if a baby is breastfed, right, the tongue is working out. As the tongue is working out, it signals the sinus cavity develop properly. It also tells the functional airway to develop properly, as well as the dental arch. So when somebody has a thumb sucking habit, which activates their palate a little too much, they end up with a V-shaped palate, which on top means they have small nasal cavities and their tongue doesn't rest at the roof of the palate where it needs to. So they become mouth breathers. Right? The snoring happens, the mouth breathing occurs, which creates the perfect storm, that dry mouth for these bad bacteria to live and grow and cause disease.
As we get older, I mean, what can we do about making sure that we breathe properly? Is there anything we can do about the tongue?
Absolutely. There are so many things. There is something actually called myofunctional therapy, tongue training exercises, because the tongue is going to get loose as we get older. Let's be honest, we get wrinkles in our face. It's going to happen. And tongue is a muscle. So it's going to happen with the tongue as well. And so what we do is just like we go to the gym and work out our muscles to make sure that our muscles are intact, the same thing needs to happen for the tongue. What we do with the tongue is tongue training exercises in order to make sure that the tongue is super strong, stays at the roof of the palate so that you can nose breathe really well.
Okay. Could you give an example of one of these tongue exercises?
Yes, one of my favorite ones is, if you're ever stuck in traffic, you can always stick your tongue out at someone. That's
Okay.
always my favorite. You can always do tongue clicks.
Right.
You can do 100 of those. That's an example. You can also do a tongue taco. There you
Okay.
go. You get to hold that for 2 minutes. Try that. Yes. So that really gets that muscle working. Just like we do exercises for our abs, we have different muscles that we want to strengthen. The tongue has different muscles that we want to strengthen as well.
And would this also impact sleep apnea?
Absolutely. Actually, we're in San Francisco, so Stanford is close by, one of the most amazing institutions in the world and leading in innovation, technology, of course, and medical care. Myofunctional therapy is actually designed, tongue training exercises is been actually shown to give benefits immediately. There are patients who get a 30% benefit just from doing exercises to be able to help stop their sleep apnea and make sure that they can breathe really well.
Right. Because sleep apnea is also related to dementia because it reduces the blood flow, well, the oxygen flow to the brain.
Exactly, exactly. And that's why dentistry has become so important to prevent chronic illness and to biooptimize, so that we can avoid a lot of different diseases. And the correlation is present, the causation is there. And the other thing I do want to say is everything is multifactorial. It's not just one thing, right? Let's be honest. It's not just one thing that's causing all these problems. Usually, we said it takes 10 to 13 years for disease to occur. These bad bacteria are probably in the mouth. That's number one. This person probably doesn't have good sleep, probably doesn't have the best diet, has a lot of stress. You combine all of that together over a period of time, and that's when we see chronic illness.
Does the microbiome in the mouth also affect the immune system in any way?
Absolutely, absolutely. The oral microbiome is, especially when we have pathogenic bacteria. If we have the good bacteria, our body is functioning fantastic, great, no problem. But when we have the pathogenic bacteria, it does take a toll on our immune system. Our immune system is spending reserves trying to fight these bacteria off, right? It's an infection, just like we would have an infection in any spot. It's an infection that your body is trying to get rid of. And if your body is spending reserves on fighting an infection, it's probably not going to have energy for regenerative care, right? And that's why we see a huge correlation with cancer and overgrowth of these bacteria. So, those are some things that we find on a regular basis. People with failed root canals, that biome, there's infections that are sitting in the mouth that are taking up the body's energy and reserve, and it's not because we have cancer cells on a daily basis. Our bodies are able to clean them off. And when there is an overload of pathogens, our body can't spend the energy for regenerative care. It's going to be focused on fighting attack, making sure infection is controlled.
Thinking about root canals, because I've heard this before that, the root canal, you go down, explain what a root canal is and how it works. And
So
how does it get infected?
So a root canal there's an infection that is so big that it enters the inner layers of the tooth. So that now a root canal is a procedure that is done where they take out the blood supply of the tooth and they plug it with a rubber-like material. And that is what a root canal is. Now, the concern with root canals is that because of the way that our teeth are shaped, there's accessory small canals, just like the way we have arteries, then we have capillaries, and then we have those microcapillaries where a nutrient exchange actually occurs. The teeth have the same thing. It's just that we, at this point, do not have technology that will be able to get into those microcapillaries and clean them off. So when those microcapillaries are still infected, what happens is over a period of time, it causes a lot of chronic illnesses. One commonly known is cancer.
How do I know if I've had root canals? How do I know whether my root canal is infected? I assume
The
it doesn't hurt.
Yeah, the best way to test for that, a lot of times actually dental infections don't hurt, just like cancer does not hurt. It's usually they don't hurt. The best way to be able to see that if you have a failed root canal is through a CT scan. When there is a CT scan done, we can see if there's a small foci of infection that's brewing. That's what we would be looking at.
So a CT scan, so an X-ray won't show me.
An X-ray won't, a cone beam will. A cone beam is really wonderful because a cone beam is able to visualize in higher detail and has better resolution so that we can actually see if there's a small foci of infection that is still brewing inside a root canal that has been completed.
Okay, so tell me about a CT scan because I'm
Uh,
I'm aware of it for like arteries, but not for teeth.
Yes, and so the CT scan that is done for arteries, we can actually do for the head and neck area. And we can actually, when that head and neck area is done, we can actually look at each individual tooth and see if there's any foci of infection in the jaw. We can see if there's any foci of infection at the root of the tooth. It really gives us a lot of information. It even tells us where the tongue position is. We were just talking about sleep apnea earlier. We can actually test and see how small the windpipe is. We can even see if there's mucositis in the sinuses, if there's problems that are happening in the sinuses. We're able to see a lot of information from a cone beam scan because it is highly specific and we're able to see things in 3D, in three dimensions.
Where could you typically get such a scan? I don't think like my dentist would, high street dentist would do that.
One of the things you can actually search for cone beam analysis. There are usually organizations or places where the cone beam can be ordered and evaluated. Ear, nose, and throat doctors will definitely do them. A holistic biological dentist or a functional dentist, of course, is always going to do these. So those are some great places to start. An ENT is a easy way to get started because they are doing cone beam scans all the time to see sinus cavities. It can be used by a dentist to be able to evaluate if there's any failed root canals. Even root canal specialist, if you have a high-tech root canal specialist, they should be doing a cone beam scan. They'll be able to evaluate if there's any foci of infection that is brewing inside the mouth.
We talked about mercury before, which was used for fillings, I believe. So what are the concerns with like old style materials and what are they replaced with these days?
So mercury is now replaced with biocompatible materials, and there's two types. One is a plastic, a bisphenol-free, means there's no cancer-causing agents in it. The second is a milled porcelain. Milled porcelain is also biocompatible because they actually resist bacteria, and they also are metal-free, which helps your body make sure there's no allergens inside the mouth. Traditionally, crowns were metal with porcelain on top. Now we've evolved to 3D milling, and so we can make biocompatible restorations within an hour for you. And these materials are long-lasting, durable, and beautiful.
If we're thinking of practical steps people can take, so what should people's like mouth hygiene protocol look like?
Oh, this is my favorite question. Thank you for this. My first thing is I'm going to include a body and a mouth protocol. And I'm going to start with the night one first, because that's the most important because we want regeneration during the time that we're sleeping. So first of all, always shower, pick your boogers, let's get them out. Let's floss first, brush your teeth, scrape your tongue. Put some coconut oil on your gums. Just rub it around the gums because coconut oil is bactericidal, fungicidal, virucidal. So we really like that. And we really like for it to hydrate the mouth so that when you're sleeping at night, it stays hydrated and that environment stays hydrated so you don't have any of the bad bugs overgrow. And then you can always vertically tape your mouth so that way you can get good nose breathing and that nitric oxide activation. So that is my nightly routine. In the morning, you floss first, brush your teeth, scrape your tongue, and you're good to go.
Okay, so you like tongue scraping. That
Absolutely. So tongue scraping is important for several reasons. One is that there's so much bacteria that overgrows, and also when we eat food, a lot of the sulfites get stuck on the tongue, and so when we scrape them away, we scrape away the dead cells because our mouth does regenerate pretty quickly. We're scraping away dead cells. We're scraping away bad bacteria. It gives us fresh breath and it makes us feel cleaner for longer. That is the reason why I am a big fan of tongue scraping.
okay. In terms of flossing, like water picks or ordinary flossing, does it make a difference?
Ideally, flossing is the best. However, if you're not a great flosser, it's better to water pick because you're going to get a better benefit. And my little secret with a water pick is you can take like a little bit of peroxide in 8 ounces of water and put that in your water pick and use that to clean in between your teeth because peroxide is extra oxygen. And remember, we talked about all those bad bacteria? They're all anaerobic, so they live, if oxygen is present, they'll die off faster.
Right. So you're water picking with a very light hydrogen peroxide solution. Other lifestyle factors that would help your oral health, like diet or sleep. But diet, particularly, I would think.
Yes, diet, but most importantly, the first thing, Richard, I'd have to say is going to be vitamin D. Making sure that we have good vitamin D. Vitamin D is important and an integral part of your teeth and bones. So vitamin D is important for your sleep, it's important for your immune system. So number one is going to be vitamin D3. Second is going to be B12. It is something that a lot of people are deficient in. And also, when you don't have enough D3 and B12, our gut lining is not as tight and our immune system is not as strong as we want it to be because our gut is our immune system. So when we have D3 and B12 in place, we can actually have a healthy gut microbiome as well as a healthy oral microbiome. So those be the number one things that I would say. And then, of course, frequent snacking is an issue. Intermittent fasting is fantastic. I'm a big fan of that. And detoxification is really important. So, getting into the steam room or the sauna twice a week is fantastic for getting our bodies to work really well. So those would be my major things that I would really talk about. Because, when we talk about diet, we all know we're not supposed to eat sugar. I wouldn't be adding anything to the conversation if I said that to you. We know we don't eat carbohydrates. We should be cutting down on those. So, my favorite diet is a keto flex diet. Keto flex means, obviously high protein, high fat, low carbs. And the flex part is really, intermittent fasting, not eating 3 hours before you go to bed so that your body has time to digest the food. It would also have a big impact on your sleep. so that you can regenerate. So things that are maybe not just dental related, but more whole body related is where we want to think here and where we want to go.
You clean your teeth like after breakfast or before breakfast or both?
My preference is before. I like to floss first, brush my teeth because I would like to, my taste of the food, I can taste much better when I have removed a lot of the bacteria from overnight and scraped my tongue. I have a better sense of taste. I feel much better. I can brush my teeth again if I wanted to, or at least at minimum, take some water, swish around your mouth and make sure all food particles are gone. You can spit that out or swallow it, and it'll work great.
You mentioned supplements. So supplements might be a way to improve oral health. So what supplements would you suggest?
The supplements that I personally suggest that really make a difference with the oral microbiome is going to be a probiotic. The one that I absolutely love is Berkeley Life's prebiotic and probiotic nitric oxide gum. It's fantastic. It hits multiple birds with one stone. We're getting that nitric oxide. We're chewing. We are stimulating the salivary glands, making sure the mouth is hydrated, stimulating the saliva, making the IgG, the pro-inflammatory markers come out. So that is my one of my favorite tool is to be able to use the nitric oxide prebiotic gum is my favorite thing to have. And then the other part that I love is actually a product from ASEA, ASEA. It is a chlorine dioxide. And so what you do with that, you swish, 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 and swallow. The reason I like that is because number one, chlorine dioxide is a great ion for us to have. It also helps the cellular linking of all of our cells so that we can be better protected against any sort of bacteria or viruses. It actually works really well in the mouth and it actually works really well in our intestines as well, making sure that our cellular or cells are interlinked very tightly.
If you eat a good diet, would you normally think that your oral microbiome would be okay? I mean, does it generally look after itself?
No, it doesn't, because one of the things that happens is that you can eat healthy, which is fantastic, but because we're living long now, we're living beyond 60. We're starting to develop that sleep apnea that comes around in the 60s and 70s, right? The dry mouth starts coming around in the 60s and 70s. Um, just by eating healthy is not going to solve the problem. We have to start adding nutraceuticals to be able to help us deal with the oral microbiome much better, which is what I mentioned earlier with the nitric oxide gum. More frequent cleanings, mouth taping, coconut oil on the gums. All of those things are all adjuncts that help us keep our microbiome healthy.
How would how would someone uh, monitor their oral health? I mean, is there any way to do it at home? We've talked a number of ways, right? We talked about the saliva tests, but is there? How would you do it more? I guess more lightly.
Well, the easiest one I always like to say is put your hand in front of your mouth and blow out and then see if that smells or not. Because if you have sulfur containing bacteria, we know there's a little bit of an issue. The second thing you will also see is that when you floss and you brush your teeth, is there blood coming out in the sink? That's going to tell you there's a major concern happening, right? Those are some basic things to start with. And then if there is a concern, we can do the salivary testing and go down that path.
How often should you see a dentist? How often should you get a cleaning?
If you are healthy and have no concerns, that means no chronic illness, I would say you can go every 6 months. If you are above the age of 40, I would recommend every 4 months. After 50, I recommend every 3 months. The reason being is 0 to 40, you're probably going to be okay. 40, sleep apnea starts developing, just like the wrinkles start appearing. Mouth dryness starts happening. Women start perimenopause, menopause symptoms. So those all happen between 40, 50. 50s is when menopause occurs. For men, sleep apnea occurs even more. And then by 60s, the salivary glands are declining, means that the mouth is becoming drier because as we age, that's what happens. Our body just doesn't work as well as it did. So the saliva that is in the mouth is a lot less in your 60s than it was when you're 30s. So that dry environment creates a higher risk for more bacteria to overgrow. Hence, coming in every 3 months for cleanings to remove the biofilm.
And it sounds like this would be for males and females, men and women, but kind of for different reasons.
Yes, different reasons, absolutely. Different reasons all cause the same problems. Heart attack, diabetes, cancer, Alzheimer's, arthritis, all diseases that are chronic illnesses associated with age.
Your microbiome is just not as good as it should be. So
It
yeah,
No, I was going to say it is. So the thing is, what's changed in the last 20 to 30 years is longevity has occurred because people are living longer is the reason why we're now discovering all of these things, right? Before there was a time when 60 was the end of life and 70 was like, living for a very long time or 80. We're going to be pushing 120, especially with the amount of knowledge that we have nowadays. People are going to be living till 120. We have so many people living till 100 already, so many centurions, especially with these blue zones. We've have natural blue zones. We're also having man-made blue zones like Singapore. And because we are so into biohacking as a society, we're going to be living a lot longer and we're going to notice a lot of changes in our bodies that require adaptations. And that's why dentistry has become the forefront now, which has been a real big stepchild of medicine for many, 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 many years. But now that people are living longer, we're noticing the correlation between dentistry and how we can prevent disease and how we can live long and biohack ourselves realistically.
absolutely. And yeah, the using the how we used to work before, what used to work before, based on the idea that that's what we evolved for, works for a certain stage. But then, yes, when you're getting to ages that we never got to before, then yes, you have to do these extra things, which is exactly what you're talking about. And I agree that dentistry and the mouth just don't get much attention in longevity.
Yes, and it is going to be the wave. More and more dentistry is becoming at the forefront of so much because it's so easy and it's preventable. And it's so much easier to get your teeth cleaned 4 times a year than it is to ever deal with cancer or to, slow down the progression of Alzheimer's. And I have many patients where the progression of Alzheimer's slows down significantly because we've cleaned up their mouth, we've focused on their sleep, and it works amazingly. Same thing with cancer patients. We're seeing that when we clean the mouth, their chemo is working better because your body doesn't have to fight these bacteria from a microscopic level. The chemo is working so much, much, much better, and they're not having as many side effects.
So what would someone what should someone look for to say, okay, I need to go and see a dentist? But actually, if we're going to see one every 3 months, then that would we'd be seeing them anyway. But actually, if I go to my normal dentist and ask for a clean, I suspect they'll do a clean, and that's pretty much all they do. Um, what would be a sign that we should go and see like a more functional person such as yourself?
Well, number one, if you have any sort of chronic illness, cancer, thyroiditis, autoimmune conditions, would be a reason to see someone like me or a functional biological dentist. Also, if you have, cancer or anything like that, The other thing is medications. If you're on any sort of medication, anti-anxiety medication, ADHD medication, those would be cues to go seek a more holistic, functional root cause dentist because we can actually help with those. The other people are actually biooptimizers or somebody who wants to biohack and live long. That would be an ideal person that says, I'm curious. I want to know, what does my mouth look like now? I may not need extensive treatment, but if I could use this nitric oxide gum and help prevent disease down the road, this would be fantastic, a nutraceutical to add to my repertoire. Or if I should add, a little bit of peroxide to my water pick, that would be a great addition so that you can live a long, healthy life.
And getting, I guess, preventative saliva tests would also be quite helpful to tell what's in your microbiome.
Yes, and also believe it or not, we can diagnose things a lot sooner too. I had a couple months ago, I had a remote employee who was doing my answering my phones, and we always invite them to our practice to discover how we work. And she was living in Arkansas at the time and came into our practice. We did her salivary testing, and we found increased amount of FN and something was just not right. She had sleep apnea, she had a lot of different conditions. And so, long behold, after her medical visit, they found a tumor on her liver. So we're actually able to see the correlation because we'll see increased amount of specific bacteria that are known to cause tumors, known to cause different diseases. So for sure.
Do you have, I mean, that's an interesting story. So the bacteria started in the mouth, or it started in the liver and it went to the mouth.
No, it started in the mouth and went to the liver. The reason being is these bacteria for a long period of time, if you're not getting them cleaned out, is where it occurred. Plus, certain habits need to be present. It's not just one thing, it has to be multifactorial. It's not the chicken or the egg, it's both, right? It's you
Right.
can never just say it's one thing because if it was just one thing, your body would have already fixed it.
Yeah.
It's like a leaky pot with 100 holes, and that's when disease occurs. It's not just one thing that causes disease, right? Because our bodies are designed to fix themselves. Our bodies are designed to work.
Right.
When
And yeah, and having the bad oral microbiome is just adding one extra thing. So, and over time, it just builds up too much, and it could be the first thing that goes, or at least it's going to be related to the diseases that start.
Yes, and the reason why it's so important is because we eat. That is our primary source of energy. So if this is contaminated, everything that we're having is contaminated. And that's why the mouth becomes so important. If you have pathogenic bacteria in the mouth and you're using this mouth all day, every day, it's like an industrial kitchen that is cooking for millions of people because we're eating multiple times a day. So if this is infested and you're continue to use that, it makes the disease process go even faster.
Yes, I hadn't thought of it like that, but it is. It's like you have bugs in your kitchen, and then not good.
Exactly.
Okay, so if people could change one habit that they do in terms of their oral health, what would you suggest that is?
You've already heard of brushing and flossing, so I'm not going to use that. But I will say mouth tape. Mouth taping is amazing as far as your oral habit because when you tape your mouth, you really increase the amount of nitric oxide your body makes because you are forced to breathe through your nose. So that's what I would recommend. Just be careful if you mouth tape and you don't make sure it's not too tight so that if there is some sort of an obstruction, you don't cause some a health concern. So make sure it's loose so you can actually open it to breathe if you needed to. So that would be my biggest recommendation. And second is tongue scrape.
Okay, just on the nitric oxide, if my blood pressure is okay, which I think would imply that my nitric oxide is generally okay. Uh, is that correlation valid, do you think?
No, because that what nitric oxide would tell me is you can never have enough nitric oxide, right? Your body's never gonna, it's never gonna be bad. So having nitric oxide is going to, because your own body produces it and your own body uses it to fix itself, right? So nitric oxide is so many different pathways. So when we add nitric oxide, or if we are concerned about how much nitric oxide we have, the best way to test it is you can actually test it. Berkeley Life actually has strips you can test. You can put it on your tongue for 10 seconds, and it'll actually tell you how much nitric oxide you're producing. Because, for example, if you have a drier mouth, your nitric oxide production is actually going to be lower than somebody who has a mouthful of saliva.
Right. Okay, so where can people go if they want to learn more about you and your work?
Oh, wonderful. If somebody's interested, you can go to my website is SF as in San Francisco, Green, Green, dentist, dentist.com. You can always give us a call, 415-433-0119. And if you just want to learn a little bit more, there's a lot of blogs, there's a lot of videos that I have on my dental website, my dental office website, as well as my drnamipatel.com website. There's courses you can take, learn about myofunctional therapy, and you can learn and do this on your own, learn about these bacteria and how they cause disease. So you can definitely learn a lot of those things there as well.
Okay, and you wrote a book, right?
Yes, and you can also get my book. It's called Age with Style: Guide to a Youthful Smile and Healthy Living. And the purpose of the book is what can you do at each stage of your life so you can avoid disease and dysfunction? So, what can you do? If you have children, what can they do when they're babies, when they're 10 years old, when they're 10 to 20, 20 to 30, 30 to 40, 40 to 50, 50 to 60, and so on? Because every decade of our lives, our mouth changes and so does our body. And I like to correlate both.
Okay, very good. Okay, Dr. Patel, thank you so much for joining us today.
Thank you, Richard.